Have you ever wondered just how deadly the air we breathe in is? In recent years, with the rapid growth of industrialization leading to many byproducts from manufacturing and power generation, more pollutant fumes from coal-fueled power plants and chemical production have been manufactured. Likewise, rising environmental disasters relating to climate change, like recent wildfire incidents, have contributed to this. The emission of harmful gases such as sulfur dioxide, carbon monoxide, and more, alongside particulate matter sized PM2.5 and PM10 from such sources. They can end up deep in our lungs and our bloodstream, leading to inflammation, oxidative stress, or worsening of our respiratory system like coughs, shortness of breath, and chest tightness. In more severe cases, cancer, heart diseases, stroke, and symptoms just as severe. Studies from organizations like the World Health Organization, or WHO, have even shown that a rise in infections, heart disease, and even early deaths in those with maintained long-term exposure. WHO data also shows that almost all of the global population, which is around 99%, breathe air that exceeds their guideline limits and contains high levels of pollutants. Those with respiratory issues show a downturn in their condition in relation to those with access to cleaner air, while the more vulnerable groups, like children, elderly, and low-income communities, are those most adversely affected by it. Because of lack of actionable information and data, individuals are prevented from taking action. Air pollution has only become more pressing in our society, and it could become worse if nothing is done about it. So let's dive into this issue and see what we can do as a society. There are semi-frequent wildfires in Indonesia, where haze from the smoke travels to Singapore. For example, recently this occurred in 2023, which destroyed many forests while polluting a multitude of provinces. This exposed over 29 million residents in Jakarta to unhealthy air. Pollution from wildfires like these may seem self-contained within their nation. However, transboundary pollution can occur where the smoke from the wildfires make their way to neighboring countries. As of 25th of July 2024, amongst the top 10 diseases with the highest mortality rates in Singapore, at least 3 out of 10 are worsened by air pollution, with pneumonia being second to cancer in highest mortality rate in Singapore, even since 2019. Comparatively, over the years, there has been a declining trend in deaths from others. So what can we do about this?
When it comes to addressing air pollution, there are two sides to the solution, individual and societal. Individually, it's about preventing the effects of air pollution on ourselves, while as a society, it's about reducing air pollution at the source. On the societal front, things like improving public transport, implementing more emission regulations, and urban greenery can make a big difference, but these take time and require major policy change. Meanwhile, individual action is something we can take immediately. Apps like IQ Air show it's possible, offering real-time air quality maps, localized metrics, AI-powered forecasts, and personalized recommendations. But we believe there's more room to build on top of that. Our app draws inspiration from these features, but takes it further with a stronger focus on personalization and practical health guidance. By evolving what platforms like IQ Air have started, we hope to deliver something even more tailored and impactful for our users. So, what steps can we take to stay safe and informed in the face of rising air pollution? Well, that's exactly what our app is designed to help you with. Let me walk you through the key features that make this app a smart and personalized tool for your daily life. First up, a personalized air quality rating. Our app provides real-time air quality updates tailored to your exact location across the island. But we go beyond just the basic AQI number that you get anywhere on the internet. You'll get detailed breakdowns, including wind speed and direction, parts per million or ppm of the pollutants, temperature, and humidity. All these factors affect how the air feels and how it can impact your health. Next, I'll move on to the recommended activity level. Based on the current air quality, this app will suggest the most suitable activity level for the day. Whether it's a good day for a run outdoors or better to stay inside, you'll get clear, actionable guidance to help protect your health. Moving on, we have the interactive map of Singapore. Here you get access to a live map of Singapore showing varying air quality levels in different areas. Whether you're commuting, planning an outing, or just curious, you can check the conditions across the island and make informed decisions for your life. And finally, an AI chatbot. Our smart assistant learns your specific needs, whether you're someone with asthma, allergies, or just prefer to be cautious. The AI chatbot will remind you to wear a mask, bring your inhaler, or even suggest nearby indoor alternatives to outdoors if the air quality drops too low and could negatively affect your health.
Our app isn't like other air quality apps. I'm going to talk about 3 reasons why our app is unique and differentiates us from other run-of-the-mill air quality apps. Firstly, our app is made with our users in mind. Users wouldn't understand or relate to the advice if it's given through robotic-like dialogue, which is why we'll use AI to give human-like dialogue. This will engage our users and increase the likelihood that they will use the advice provided. Another feature that makes our app unique is localized insights. Our app will use real-time data from your specific location instead of broad data for the entirety of Singapore. This will allow us to give more accurate results and more personalized responses. Lastly, what made the app specifically special and is our main feature is personalized responses. By asking the user questions when they install the app, we can give ultra-specific advice based on the user's age, health conditions, and lifestyle. This allows the users to feel like the app is made specifically for them. I'm going to share some examples on how our app can help different demographics. Firstly, we have Uncle Lim. He's a 67-year-old elderly man. Fortunately for him, he likes to keep active by taking daily walks. Our app can let him know to skip his daily walk and stay indoors when the air quality drops in order to help prevent health problems down the line. Next, we have Amy. She is only 7 years old and loves going to the playground to play with her friends. During hay season, our app can inform her parents when it's safe to play outside. Next, we have Aisha. She's a 30-year-old asthmatic. Due to having asthma, she is prone to having respiratory ailments. Our app can warn her early in case of bad air quality, so she can wear an N95 mask and bring her inhaler during daily commutes. Lastly, we have Harish. He's a 16-year-old teen athlete who does intensive training regularly. The app gives him advice on how to train safely during hay season and to avoid health problems down the line. I'm also going to share some other possible features we can add to our app. While our main objective is to combat the dangers of air pollution, we think that a section in the app for UV health guidance will fit in perfectly, especially in Singapore, where it's almost always sunny. Alongside the localized data for air quality, the app could find the UV index of the user's current location and give sun protection steps, like reminding them to put on sunscreen on a sunny day. This could prevent skin problems from rising, like skin cancer. Another possible feature we can add to our app is integration with smart devices. The app could send alerts directly to smartwatches and even track user respiratory data to offer more personalized health advice. It could also connect to smart air purifiers, automatically turning them on when air quality drops below a safe level. In addition, the app could work with voice assistants like Alexa or Google Home, providing brief reminders, daily air quality updates, or simple health suggestions.
Now, I'm going to share how our app benefits society and its well-being. Our app reduces risk of respiratory illnesses through personalized, real-time guidance. This especially helps sensitive groups like the elderly, children, and those with asthma take timely precautions like staying indoors or wearing masks, reducing exposure and preventing health issues. Moreover, our app supports preventive care rather than reactive care. People can live their lives with less risk of respiratory diseases, cutting down on medical expenses for treatment. This can help out for the less fortunate individuals who are unable to afford proper medical care. Additionally, it relieves some of the load on medical professionals, allowing them to focus on other issues and lower resource usage.
Overall, this app will revolutionize respiratory health through its many unique functions and possible features, as well as its personalized responses for people from different communities. It allows the users to breathe better, think smarter, and live healthier. We hope you enjoyed our presentation.
Thank you.